trend alert, more men are doing facial and other plastic surgery procedures, and we're gonna break it down full throttle next. Hey Doc audience, men in plastic surgery. Rod, this is something that everybody I think has seen. We've got a story here, but this is something that we've seen for a few years at least, where more men are coming in because they want to get a leg up in the corporate world or they want to feel better about themselves. But are you seeing more men coming in wanting procedures done?
I am. I'm seeing more men. They used to come in, later in the day or off hours, but it's pretty common. I mean, they started with Botox, but now fillers, jawline fillers like this article. I think it's good. It's normal. And as long as it's not overdone, it really has to be very subtle, especially in males. Otherwise, it looks weird. So I think it's very, very common. And, and it's males that, really, really are paying attention to their skin, their face, their body, and it's okay.
Yeah.
Right?
I mean, and I'm a solo practitioner, but my office is all female staff. And it used to just be like the begrudging husband that one of my patients brings in and is like, please take care of his eyelids. Right. But now, they're noticing more and more, especially things like upper eyelid surgery that, there's nothing, demasculating about when your eyelids are flopping over your lashes, take care of it. But also I'm seeing men come in for the non-surgical side to the med spa, for the little tweaks and facials and kind of embracing it and loving it and letting us use their images on social media, which was never a thing I could do in the past.
You brought up a good point because they have had their wives come in and they look better and they don't want to be left behind. They don't want to, hey, is this your dad? No. Especially in Dallas, you never say, is this your? Because it could be somebody.
Never
you don't know. So it's good.
Yeah, Armando, so it used to be that people didn't want to tell people, they didn't want to admit they had plastic surgery, but now you're almost like an outcast if you're not doing it. So
it does seem like a badge of honor among some younger guys, right? I see a lot of older guys too that are in competitive professions, and their coworkers are all younger and they just want to, stay looking healthy. As long as, I agree with what Rod said, as long as it looks natural, as long as it looks authentic, I think it's a very positive thing.
Yeah, and what do you think? Leave us some comments. What types of procedures are you interested in? John, what are you seeing in your area in terms of, is it more surgical or is it more non-surgical?
It's really a blend. Botox has been around for men quite some time now. We have, regular patients that come in all the time for that. But there's a lot of emphasis on the jawline and neck in our male patients in particular, because it gives a more dynamic look to the face. And of course, the upper eyelids in particular, these are the key zones, and it's a competitive world out there right now. And so more and more men, I think, are interested in keeping that competitive edge. Plus, they're just doing it for, their own sense of well-being, and that's a great thing.
I mean, look at those studies. We've always seen it where what is your initial reaction when you see a picture of someone, in particular a man, with like a receded or a weak chin, with a blunted jawline as opposed to angular, strong, or quote unquote masculine jawline. But, you make assumptions, we naturally, inherently, without even realizing it, just by looking at features on a face, which is crazy but true.
Right.
So
it makes a big difference.
Yeah.
Little things make a big difference.
Yeah.
And males don't necessarily like surgery, so these non-invasive things are actually very appealing.
Mm-hmm.
Yeah, like Rod, you have a huge offering of non-surgical things. What kind of new technologies are you seeing men gravitate towards?
I think one of the biggest things is the use of radio frequency and ultrasound skin tightening, because it can be done in the office along with jawline fillers and cheek fillers. So you combine all these things, and with Botox, they love it. They can come in, go home, and go to work the next day. That's great.
We're seeing the muscle stimulators, the things that, especially if someone has an injury and we can still keep that muscle, going and stimulate it.
How does that work? Does that work well?
Our patients love it because you can come in and really focus on one muscle and really keep that muscle, especially if they have downtime, whether it's an injury, whether it's surgery, and if you can do something to another group of muscles that might not be the injured or operated on area, and keep that from hypertrophying or shrinking down, it makes a big difference, especially if somebody's been working hard at the gym.
Yeah, yeah. Armando, you were telling me in the break about your experience with SoftWave. That's a new technology I think you've introduced in the past 6 months.
I love SoftWave.
Is that, how about for men? Does it work for men?
Listen, I'm a SoftWave patient myself, and I can tell you.
And you're a man.
Usually. I lost a bunch of weight last year, and I should be dripping in skin, and I'm just really not because of the SoftWave treatment. So I personally am very happy with it, and my patients have been very happy. It's non-invasive. There's no recovery time. I think it's a great treatment for men.
So John, what would you say to a man who's not done anything but is interested?
Yeah, I think the thing to do is really talk to the patient and find out what is their focus, because what I say may not be. How often people come in and you think it's going to be about one thing, but they're really interested in exploring another aspect. So you want to be a problem solver, and you want to offer helpful suggestions as well. I mean, one of the easiest is obviously Botox, because a lot of us get into habits of concentrating and, it can make you look tired. And Botox is probably one of the easiest things you can do. It's a great starter. I think a lot of our patients start with Botox and then go on to other things, including surgery.
Well, look at what Armando just mentioned. He tapped on something that's really, really, really big these days. We haven't talked about yet. Weight loss. And we have a lot of patients that are on their weight loss medication.
Yeah.
And your body is changing. Whether you're doing it with medication or diet and exercise, your body's going to change. And so they don't want to look, like you said, dripping in skin. So what can we do, to keep the muscle tone, to keep the skin tight? That's become a huge area of growth for men in my practice.
Rod, what do you do? Historically, men have always been, coined or I guess stereotyped as poor communicators. At least my wife tells me that about me. And but I mean, it's been in plastic surgery. Like, women are very good. They come in and they tell you what's bothering them and I think sometimes, again, like I don't know if this is just a bogus stereotype, but that men don't communicate as well about what bothers them. But do you find that, or maybe is it that the new man just open about their shortcomings?
I always, the way I relate to males is I say, listen, we're not good listeners and we're not good patients.
Listen here, bro.
Right. Listen. So I think there's some degree of truth there that, males like that instant result and we don't listen very well. So that's a problem. So you have to kind of go over things a little more than you do with a female patient, both pre-op and post-op. And they tend to also want to bounce back quicker. So you have to treat them a little different, a little more firm.
Armando, what's your experience with
I think that's absolutely true. Guys tend to be less patient, right? So they want kind of an instant result, but instant results aren't always as natural looking. And so those two things sometimes are counter to each other. So I just explained to them that, for example, we were talking about SoftWave, the treatment is going to progress. And I explained to them that that's a positive thing. Over time, they're going to see more and more improvement. It's going to be gradual, so subtle, but they're going to get a meaningful change. And you need to remind guys more often. I think female patients are generally more on board with recovery times, discomfort, time for a result to progress. But you just stay on them, remind them, and keep it positive.
Yeah, well, the pain control thing is definitely true. Women are way tougher. In fact, that's why they use Corganics for our men. Right, the CBD rod, and they keeps them off opioids and things. But I want to get back to I think there's some, in defense of all the men. Okay, Renee, I'm sure you would support this too. But I think some of it's like selective hearing loss, and females sometimes, my wife said, "What the hell is this RV you just bought?" I said, "You said you were going to CVS." I said, "No," I said, "I'm going to buy an RV." So it's just like she hears what she wants to hear, and so the guys aren't that bad. Let us know what you think. Give us a like, and then make sure to subscribe, and we'll see you all next time on Hey Doc.